Welcome to the Dub Dive. Today, we're diving into something, well, most people would rather just avoid altogether, right? Long-term care. But, the best way to tackle something scary is head on. And you've already taken that first step. With all these articles and notes you send over, you're thinking ahead. That's huge GE.
Absolutely.
Hmm.
So many people just assume it won't happen to them
Mm-hmm.
or that Medicare will just kind of magically cover everything. But the reality is, nearly 70% of people turning 65 will need some form of long-term care during their lifetime.
70%. Okay, wow, that's way higher than I thought. I mean, that really hits home, Suddenly it's not just some abstract concept. It's like, statistically speaking, most of us are going to face this at some point.
Exactly. And it's not just about nursing homes either, which is what a lot of people picture, right?
Oh, wow, help with.
Everyday things,
Right.
bathing, dressing, even managing finances. And this care can be needed for years, not just a few weeks.
Okay, so we're talking serious time and serious potential costs here. Speaking of cost, I was surprised to learn that Medicare, which so many people rely on, doesn't actually cover most long-term care expenses.
Yeah, it's a very common misconception. Medicare does cover up to 100 days of skilled nursing care. But there are very specific requirements. You need a qualifying hospital stay and require daily skilled nursing or rehab services. Think of it as short-term, medically necessary care.
So for that long-term assistance with daily living, Medicare isn't the answer. And when you consider that the average nursing home stay is 2.5 years for women.
And a year for men, well, suddenly we're talking about a huge potential financial burden.
Absolutely. And it's not just financial either. Think about the emotional and logistical impact on families. Loved ones often become caregivers, which can affect their jobs, their finances, and their own well-being.
That's like a ripple effect, impacting everyone involved. So before we dive deeper into potential solutions, let's debunk some common myths about long-term care, because I think a lot of people are operating on bad information. Great idea. Let's start with the myth that a spouse is forced to spend down all their assets before their partner can qualify for Medicaid.
Yeah, I've heard that one too. Like one person gets sick and the healthy spouse ends up penniless. That can't be right.
It's not tie right. Thankfully, there are what are called spousal impoverishment protections in place. This means the healthy spouse can keep a certain amount of income and assets.
Okay, that's a relief. Another myth I've heard is that you can just transfer all your assets to your kids to protect them, right? Like, problem solved.
Nope, not so simple. Medicaid has a 5-year look-back period, meaning they check for any shady asset transfers, and if they find any, you can face penalties and delays in getting coverage.
Wow. So it's really important to play by the rules and get good advice.
Okay.
So we've busted some myths, but now let's get real about the cost of care. I was floored when I saw these numbers in the research you sent. A semi-private room in a nursing home costs an average of $260 per day.
Yeah, and remember those average lengths of stay we talked about. That adds up fast. Even assisted living, which is less intensive care, averages $150 a day. And if you prefer to stay at home, a home health aide averages $27 per hour. These are significant costs. That can drain your savings incredibly quickly.
Okay, this is feeling pretty heavy. Is there anything we can do to soften the blow? I know you mentioned long-term care insurance earlier. What exactly is that?
Long-term care insurance is designed to help cover those exact costs we're talking about. It can provide you with the financial resources to receive care where you choose, at home, in an assisted living facility, or nursing home. It's about having options and maintaining control.
That sounds promising, but I'm guessing there's a catch. It can't be that easy, can it?
Well, the key is thinking ahead. You need to consider this insurance before you need care. Pre-existing conditions can make it very difficult, or even impossible, to get coverage later on. Ideally, you'd explore this in your 50s or early 60s, while you're still relatively healthy.
So it's like any other insurance. The best time to get it is before you need it. But I'm assuming this type of insurance isn't cheap.
It's definitely an investment. But the source material does mention a potential upside. The premiums can often be deducted as a medical expense on your federal income taxes. That can help make it more affordable.
Okay, so there are some potential tax advantages, but how do you choose the right policy? I imagine there are a lot of options and factors to consider.
You're absolutely right. Choosing a policy can be overwhelming. One of the first things to consider is what's called the benefit period. How long will the policy cover your care expenses? They can range from 2 years to lifetime coverage. And obviously, longer coverage comes with a higher price tag.
So you have to weigh the peace of mind against your budget. What else should people be thinking about?
The daily benefit amount is crucial. That's how much the policy will pay towards your care each day. Think about the current costs in your area. And don't forget to factor in potential increases due to inflation. You don't want your benefits to be eroded by rising costs over time.
That makes sense. And what about something called the elimination period? I came across that in one of the articles. What is that exactly?
Think of it like a deductible. It's the waiting period after you become eligible for benefits, before the policy starts paying. It can range from 30 to 90 days or even longer. A shorter period means you get covered sooner, but your premiums will likely be higher. It's a trade-off.
So many things to consider. Are there any other key factors we should keep in mind?
Two more big ones. Inflation protection ensures the benefit amount keeps up with rising healthcare costs, so your coverage doesn't lose value over time. And of course, you want a financially sound insurer, a company with a good track record of paying claims fairly and promptly. After all, you're entrusting them with your future care.
Wow. Choosing a policy is a big decision. And it seems like having professional guidance would be crucial.
Absolutely. A qualified financial advisor who specializes in long-term care insurance can assess your individual needs and help you find the best fit.
Okay. So far, we've tackled some hard truths about long-term care, busted some myths, and explored the potential of long-term care insurance. But I know this is just the tip of the iceberg. What else should we be thinking about when it comes to planning for the future?
Well, insurance is just one piece of the puzzle we need to talk about. Creating a supportive network and plan that protects both your assets and your dignity as you age. And that's where things get really interesting.
I'm all ears. Let's dive into that in part 2.
You know, it's not just about finances. It's about your living arrangements, your support system, and ensuring your well-being as you age.
Right. It's about the whole picture. And it's a conversation a lot of people put off, which can lead to hasty decisions later on, during a crisis.
Proactive planning makes a huge difference. It gives you control over your choices and preferences, so your wishes are honored. Plus, it provides a roadmap for your loved ones, which can ease their burden during a potentially stressful time.
I get that, but where do you even begin with this kind of planning? It can feel so overwhelming.
Start with honest conversations with your family. Talk about your concerns, your expectations, and your preferences for care. It might feel awkward at first, but it's crucial to get everyone on the same page.
Those conversations, they can be emotionally charged, can't they?
Yeah, they can be, but they're so important. It's about establishing a shared understanding of everyone's roles and responsibilities. And remember, you don't have to go it alone. Seeking professional guidance can be invaluable.
So who are the key players on this long-term care planning team?
Well, an elder law attorney can advise you on Medicaid planning and asset protection. A geriatric care manager can help assess your needs, coordinate care, and be your advocate. And a financial advisor can help you. Create a plan that incorporates potential long-term care costs.
It sounds like assembling a team of experts can bring a lot of peace of mind.
Absolutely. Having professionals you trust can make all the difference in navigating these complex issues.
Now let's circle back to the topic of preserving dignity, which feels so central to this whole conversation.
You're so right. It's about respecting an individual's autonomy, their choices, their preferences. It's about ensuring they feel valued, heard, and understood, even when they need help with daily activities.
Are there any practical steps we can take to promote dignity in a long-term care setting?
It starts with communication. Actively listen to the individual's concerns and preferences. Involve them in decision-making whenever possible. Respect their privacy and personal space. Simple things can make a world of difference.
Those are great points. It's about treating each person with the respect and dignity they deserve, regardless of their age or their needs.
Exactly.
And that brings us to the caregivers. They play such a vital role in the lives of those receiving long-term care.
Absolutely. Caregivers are the unsung heroes, providing not only physical care, but also emotional support and companionship. It's demanding and often involves significant personal sacrifice.
It's important to acknowledge those challenges, isn't it?
It's essential. Caregiving can be both physically and emotionally draining. Caregivers need to prioritize their own well-being and seek support when they need it. There are support groups, respite care options, and other resources available.
So true. Self-care is not selfish. It's essential, especially for caregivers. Now, let's switch gears for a moment and talk about some alternative care options. I know you mentioned aging in place and assisted living earlier. Can you explain what those entail?
Sure. Aging in place is all about remaining in your own home for as long as possible. It involves modifying your home to make it safer and more accessible, utilizing in-home care services, and using technology to promote independence.
So it's about adapting your environment to meet your changing needs.
Exactly. It's about creating a comfortable and supportive environment that allows you to maintain independence and quality of life in a familiar setting.
What about assisted living? How is that different?
Assisted living is a residential setting that provides housing, personal care services, and social activities for folks who need help with daily activities, but don't require the level of care provided in a nursing home.
So it's like a middle ground between living at home and a nursing home.
Precisely. It offers a supportive community environment with access to assistance as needed, while still promoting independence and social interaction.
It sounds like there are a lot of options, each with its own pros and cons.
There are. And finding the right fit depends on your individual circumstances, your level of independence, your care needs, your budget, and your social preferences.
And we can't forget about technology. It seems like it's playing a bigger and bigger role in long-term care these days.
Absolutely. Technology is revolutionizing the way we approach care. Think remote monitoring, telehealth, medication management systems, and even smart home technology that can help with daily tasks and enhance safety.
Can you give us some concrete examples of how these technologies are being used?
Sure. Remote monitoring devices can track vital signs, detect falls, and alert caregivers to potential issues. Telehealth allows folks to connect with healthcare professionals virtually, reducing the need for in-person visits. Medication management systems help ensure medications are taken correctly, minimizing errors. And smart home technology can automate tasks like lighting, temperature control, and even appliance operation, all of which make it easier for people to stay independent.
It's amazing how technology can empower people to age in place safely and comfortably.
It truly is. And the advancements are happening so rapidly, we can expect even more innovative solutions to emerge in the coming years.
This has been such a comprehensive discussion, covering the realities of long-term care, planning strategies, alternative care options, and the impact of technology. It's clear that long-term care is a multifaceted issue with lots to consider.
It is. And we've really only scratched the surface, but I hope this conversation has given you a solid foundation and inspired you to take proactive steps in planning for your future care needs.
Absolutely. And remember, it's never too early to start thinking about this. The more prepared you are, the better equipped you'll be to navigate the challenges and make choices that align with your values and preferences.
That's great advice.
We've covered so much ground today, and I really appreciate you sharing your expertise with us.
It's been my pleasure. These are important conversations to have, and I'm glad we had the opportunity to delve into them together.
Before we wrap things up, I want to leave our listener with one final thought to ponder.
Okay, I'm listening.
If you could give one piece of advice to someone just starting their journey of exploring long-term care options, what would it be?
I'd say don't be afraid to ask for help.
Wow. That's such a powerful piece of advice.
There are so many resources available, people who care, and experts who can guide you.
Yeah, you don't have to go through this alone.
Exactly. It's easy to feel overwhelmed, but remember, you can create a plan that honors your wishes and ensures your well-being with the right support.
That's incredibly reassuring. Planning for long-term care can feel daunting, but knowing their support every step of the way makes a huge difference. And as you said, knowledge is power. The more we understand our options, the more confident we'll be in making the right decisions.
I couldn't agree more. Having these conversations now, while you're healthy and active, can actually reduce stress and anxiety down the road. It's about taking control and being proactive.
It's like taking ownership of your future and making sure your voice is heard. And it's not just about planning for care, but about designing a life that's fulfilling and meaningful at every stage.
Beautifully said. This deep dive has been quite a journey, one of understanding, exploration, and empowerment. We've covered the practicalities, the emotional aspects, and the trends shaping the future of long-term care.
It has been a privilege to share this journey with you, and I hope our listener feels more informed, more connected, and inspired to take action.
Me too. Remember, this isn't just about aging. It's about living well, and living with dignity. And that's a goal worth striving for at any age.
Couldn't have said it better myself. Until next time, keep diving along.